Okay, so you've probably heard we're in the middle of a full-blown psychedelic renaissance. And these compounds, they're showing absolutely incredible promise for mental health. But there's this huge debate right at the heart of it all. How do they actually work? Is it the drug itself changing our brain chemistry, or is it the profound, sometimes life-changing experience of the trip?
I mean, we're talking about conditions like depression, PTSD, and addiction. Psychedelic-assisted therapies are getting just incredible results in clinical trials, giving real hope for illnesses that many thought were basically untreatable. It's really changing the whole game in psychiatry.
So that leads us to the big question. The one scientists are racing to figure out, how is this healing actually happening? What's the secret sauce? What is the core mechanism that's creating such deep and lasting change in people?
And trying to answer that question has sparked this major scientific debate. It's basically split the research community into two camps with very different ideas. And believe me, which side is right has huge implications for the future of mental health care. So on one side, you've got the neurobiologists. They're saying it's all about brain chemistry, the direct effect of the drug on our neurons. But on the other side, you have the experiential folks who argue, no, the healing comes from the profound psychological journey itself, the trip. Let's dive into the brain chemistry side first.
Right, so this camp sees psychedelics as what they call psychoplastogens. It's a fancy word, but it just means they help the brain become more flexible, promoting neuroplasticity. Essentially, they help your brain grow new connections and break out of those rigid, negative thought patterns, kind of like a hard reset. This idea is so popular, it's even led to companies trying to develop drugs that give you these brain benefits without the whole hallucinogenic experience. But then you've got the other side, and they're saying, hold on a second. You can't just separate the healing from the experience. They believe that those profound subjective effects, things like mystical experiences or what's called ego dissolution, that's the actual catalyst for change. And this view really emphasizes that your mindset and your environment, the famous set and setting, are absolutely crucial for any of this to work. So, who's right? Is it the drug or is it the trip? For a long time, we didn't really have a big, comprehensive look at the data to settle this. But now, a major new study has done exactly that. They systematically went through all the available evidence to try and find a clear answer.
The researchers did something called a meta-analysis. Now, the easiest way to think about this is like a scientific super poll. Instead of just doing one study, they go out and they gather up the data from dozens of other high-quality studies and put it all together. This lets them see the big picture and find a signal that's way more reliable than what you'd get from any single trial.
And trust me, this was a massive job. The team started with over 1,600 potential studies. They had to carefully screen every single one, filtering out anything that didn't meet their really strict criteria, until they were left with the 34 best, most relevant trials. This whole process just makes sure that the final result is built on the absolute strongest evidence we've got.
So, after all that work, what did they find? Well, the study uncovered a clear and powerful link between the trip and the therapeutic outcome. The number they found was a correlation of 0.33. Now, that might not sound huge, but in this kind of research, that is a really significant signal. So what does that number actually mean? It's pretty simple, really. The data shows that the more profound, the more intense, and the more meaningful the trip is for a person, the more their symptoms of things like depression and anxiety actually improve. It's a direct link.
But wait, the story doesn't end there, because here's where it gets really interesting. The researchers decided to dig a little deeper. They broke down the data by different conditions and different settings, and when they did that, the picture became even clearer. Okay, first, take a look at this. When you look at mood disorders like depression, the link between the experience and the good outcome is really strong. But for addiction, it's less than half that. This seems to suggest that the subjective journey is especially important when you're treating something like depression. And wow, this next one is probably the most dramatic finding of the entire study. In controlled therapeutic clinical settings, that correlation number skyrockets to 0.50. That's a very strong link. But for what they call naturalistic or, recreational use, it plummets to just 0.14. That means the connection is more than 3 times stronger when the experience is guided inside a therapeutic framework.
So what's the bottom line here? It's that set and setting isn't just a nice little detail. It's not optional. The data is screaming that the context, having a supportive, controlled environment with a therapist to guide you, is absolutely central to making this work. It's what seems to unlock the real healing potential of the experience.
Okay, so this brings us to the big picture takeaway. What does all of this mean for the future of psychedelic therapy? Well, the results from this massive analysis have really profound implications for how we should be thinking about this new frontier in medicine.
The authors of the study themselves put it perfectly in their conclusion. They wrote that psychedelics are not just pills you can pick up at a pharmacy. They are catalysts for a dynamic process that depends entirely on the psychological and environmental context it happens in.
So in the end, this whole debate, it was kind of asking the wrong question. It's not the drug or the trip. It's the drug enabling the trip, which, when it's properly guided and integrated, is what leads to the healing. The brain chemistry and the powerful experience, they work together. They're two halves of a whole.
And that leaves us with one heck of a final question. If this huge body of evidence is telling us that the subjective experience, the trip, is so tightly linked to the healing, then what does that mean for the millions and millions of dollars being invested to create new drugs that take the trip out of the equation entirely? That, right there, is the question that's going to shape the future of this mental health revolution.